Our Cane Corso Rocky had to have CCL or Canine ACL surgery. And this video is just documenting how that went, and more importantly, how it went post-surgery. We wanted to document all that not only for ourselves in case we have to go through this again with him in the future, but we also thought that it might be helpful to other people out there whose dogs have to go through the same surgery. This all started with us noticing that he was favoring his back leg. We don't know exactly what happened. There are a couple different things that could have done it, but we aren't completely sure just because he is so active and he's always running around doing all kinds of different things. Really anything could have done it. But we took him to the local vet to get x-rayed, and that showed a partial tear. We were then referred to a vet in Maryland to see about either stem cell therapy or surgery, and they recommended we just give it some time to heal on its own since it was only a partial tear. We did that for a little bit, and he was doing better until he injured it further, at which point we decided to just go ahead with surgery. We were having some issues trying to get the Maryland vet to schedule us, and so we just went with another vet here in Virginia, and that is where this video starts.
So we started this morning at 5. Just got done with a 2-hour drive to Virginia veterinary specialists in Charlottesville, Virginia. Our breeder recommended this place. She recommended a place up in Maryland first, and their customer service was just atrocious. But these folks here so far have been great. They called yesterday, said they could get us in this morning. So Rocky's got a torn CCL, which is a canine ACL, in his left knee. So they're going to do a consult at 9, take about a half hour, and if everything looks as I have communicated to them, they'll take him straight into surgery. So after 9, if all goes well, I won't see Rocky until tomorrow morning at 10. Rocky has never been away from us. I mean, he's been in his crate while we've been out for, I think, up to 8 hours, but he's never been left with anybody. So, you know, my anxiety's high just handing him over to somebody, and then you add the stress of the surgery, and then the knowledge of the, long recovery. But he needs to be made as whole as we can make him. So I'm glad we get to do it quickly, and he gets to start recovering. So Rocky's got some trazodone and some gabapentin on board. He's feeling pretty mellow, feeling a little saucy. Not really, he's just feeling mellow. And it was about the cutest thing. About a half hour into the ride this morning, he started suckling his dodo. So he's feeling comfortable with what we're doing so far. He has no idea, of course, what's coming. Anyway, he's handsome. He's a big broken dog. He's a BBD. Oh, are you a good boy? Here he comes. Oh, you're gonna make it. There he is. There's our boy. Yeah. So I'm gonna take him out and go to the potty, and then I'm gonna call, and we'll get the process started. So we'll update you as we go. So I just wrapped up things here at the VA veterinary specialist. I'll say it throughout this whole video how great they have been until that changes. So drop Rocky off. Tech came out. She spent some time with us just talking to Rocky, making sure he was comfortable with her. We put their slip lead on him, and I unhooked the leash, and he looked at me. It reminds me of a kid learning how to ride a bike, and once they realize that you're no longer holding the seat, that's kind of what it reminded me of. But he went in, they did the eval. He has a fully torn CCL. Apparently with this type of injury, he could have also torn his meniscus, and the doctor said about 50% time they can tell before surgery, and obviously she'll take a look at that and see if it's been damaged. If it's been damaged, she'll go ahead and sever it. If it's in place, she'll leave it. Apparently, depending on the doctor, they'll just sever it ahead of time because they figure it's going to tear at some future point. I prefer to leave things in place, I guess, unless needed otherwise. So the doctor called and very thorough in briefing us, or me in this case, because I'm the other one here. And I'll come back on and I'll explain what the procedure is. But basically, they're going to take away part of his bone, put in some plates and screws. It's about a 10-week recovery if everything goes well. But after about 2 weeks, he's supposed to be able to use the leg normally. Not that we're going to let him, but it's like he adjusts to the surgery and the pain goes away about 2 weeks, and then we have to baby him for another 8. But so I just got done doing the final paperwork. I'll be back tomorrow at 10 to pick him up. Obviously, we're very anxious to get him back. But I do fully feel like he's in capable hands. They said he's been doing great in there. He really took to the tech. And so she's just been able to lead him around, and they were able to manipulate him and everything without any issues. So my confidence is a lot better now that we're into it. So anyway, update you tomorrow when I pick him up. I'm going to get Rocky. Got a 2-hour drive ahead of me. They said he would be ready around 10, so I may get there and have to wait a little bit, but I don't want to put it off any longer. So we called. Well, the doctor called yesterday, saying she was going into surgery, and then she called after surgery and said that he did really good. Like I said, we'll go over the procedure also, but because he's such a large dog, they had to put a larger plate in to hold the bone. So he's been quite put through the ringer. And then we called last night around 9 asking how he's doing, and he was just waking up and getting ready to go out for a little bit of a walk. And they said that his behavior has been great. So I'm sure he's doing good, or we would have heard something about it. So 2-hour drive, gonna get my dog. So on my way to get Rocky, I didn't get 5 minutes down the road, and as you can see, maybe you can see in the rearview mirror there, I bet you we're backed up for 5 miles at this point. So not off to a good start. So there he is. I'm exhausted from being stuck in traffic and waiting, so that's probably all we're going to get. But the report was he did great. Everybody loves him. I mean, why wouldn't they? He's got a cone of shame. They said they were going to give him an e-collar so he didn't lick, but they gave him a cone of shame, so we'll see how that goes. Oh, he's got his dodo. He's like, hey, dodo. So we're going to head home, and we'll report how he's doing as he progresses.
All right. Here he has just arrived home. Took his first little potty. There's his poor leg. All shaved up. He's moving pretty good on it.
Yeah.
Really. And apparently he was a good boy at the vet.
Yeah, they just said all good things about him.
Good representation of your breed. He's got a little weird buzz cut there on his butt.
Yeah, it looks to me like
They missed?
They missed. Well, she did say that she had a real hard time with shaving him, so he very well could have zigged while she zagged.
And we used our little ramp to get him out of the car. That came in handy. And you're gotta get the vacuum off the floor so you don't trip on it. He doesn't seem as out of it, honestly, as
Well,
I expected.
I know he gets something too.
There's a close-up of his poor little leg. And he's going to be spending a lot of time in that crate. Because we're supposed to keep him, what, pretty much immobile except a potty right now?
Yeah.
Okay.
Now we can have him with us. But
In like one room.
yeah.
All right. Welcome home, buddy. All right. It is just about 48 hours post-surgery. And this guy, I would say just probably a couple hours ago, started acting more like himself. He's still definitely not feeling good, but he's up. He was just passed out in his crate for all morning, basically. Didn't want to eat, right? He didn't eat breakfast.
No, wouldn't eat breakfast. I did manage to get his pills in him.
So didn't want to go potty, didn't want to do anything. So he finally came out when I was chopping up chicken, and
He's been kind of his normal lovey self.
yeah, he's been real lovey.
He'll come and tuck under my leg when I'm sitting at the table. He did that.
He just came over and leaned up against me, my leg. So he's starting to do little things that are more like himself. The lighting is really bad. It's really bad. We can't see you.
Yeah,
and you're dark. But anyway, I don't know if I can get his leg. His leg is starting to, swell, edema.
Yeah,
it's got fluid.
So try to see if you can get behind him because you can really see it.
Okay.
Around his ankle. So the knee is actually trying to swell apparently, but then gravity forces the fluid into the ankle.
So his ankle's pretty swollen down there.
Completely normal. The vet warned us about it, and she goes, you can either leave it and do nothing or massage it. We're supposed to massage his leg anyway, so we've been doing that.
There's his dodo. Oh, that's the first time he's played with his dodo too. That's his favorite
Good
toy.
boy.
Yeah, you got your dodo. Yes,
Show
you
his
do.
little patch on his spine.
Oh, I did earlier.
Did you?
Yeah, the little patch where they
'cause
must have missed.
We're pretty sure, because she said something about he did not like the shaver, so my guess is she went after his leg and he tried to get up and she
Missed.
missed and hit his butt.
Oh, yes. But yeah, he's had really no appetite until a couple hours ago. Right about at 48 hours. Then he ate his food. That was his breakfast. He didn't eat his dinner last night, right?
No.
And the pills has been a nightmare because he does not.
Well, he doesn't scarf, for one thing.
No.
And he's on to us.
Yeah.
He's suspicious now of everything that we give him. So this morning, I had to give him his pills, and he gets, because he's so big, he gets so many pills. 2 different pain relievers. One is an NSAID, and then 2 different sedatives. And
That's what he's on.
the basically it's 3 pills of each. There's some variation there, but basically 3. And he'll sit there and he'll watch you put them in whatever food you're going to try. And I think honestly he knows what's happening. Yesterday we had success with vanilla ice cream, and I started with that. I think he might have got 1 down, and then he realized that there was pills in it, and that was it. So we switched to 80-20 raw burger, and I actually got him to kind of perk up. And I would throw it at him and he would just scarf it for the most part. So very thankful he took his pills.
We had a panic moment and you called the breeder.
I straight up panicked yesterday because it didn't matter what it was. I called the breeder. She was giving all the tricks that she had ever known, and she's finally like, and sometimes you just gotta jam it in there and hold your mouth shut, which is what I didn't want to do.
Yeah.
And luckily we didn't have to, so. Yeah, the pill thing, and it's going to continue to be an issue. So I'm hoping that his pain management gets to where we're not having to give him
as much.
Yeah. And so just sedative as needed, and then his antibiotic, which is the number one important thing, would be the ones that we would have to deal with. So, yeah.
So as far as 48-hour mark, I think he's turned a corner.
He's turning a corner now. Tomorrow, so, and they did this to me. I had, was that earlier this year? I had back surgery.
No, I think so, yeah.
Beginning of the year, and they told me, well, we injected the site with a pain reliever that lasts for 3 days, and I had never heard of that before. Well, apparently they did the same thing with him, as they injected the site with a pain reliever. So tomorrow that wears off.
Okay.
So we may see a regression in behavior then, or he may just rely more on the pain meds.
And it is night and day between him and Bella with surgeries. Now hers was an obstruction surgery.
It took her, what, overnight to bounce back?
She was like a whole new dog the very next day. And, I mean, that's bulldogs for you, though. And she had that surgery twice in a week. The second time, she was a little more out of it. But she still bounced back so quick. And, yeah, I didn't expect that with him. He's a much bigger dog, for one thing.
Yeah, I don't think his pain tolerance is...
His pain tolerance is not of a bulldog.
But he's
probably.
got a good one.
Yeah.
And he lets us touch his leg, and he'll let us,
And you said we're supposed to be massaging that,
yeah,
right?
massage, and then we'll tomorrow.
Ice. They also told us to ice it.
And he was fine with it. We did that yesterday. And then we have to start doing like physical therapy, joint manipulations tomorrow.
Okay.
But I think he'll be fine with that.
He has his cone of shame over there that he's not had to use because they really stress the importance of not letting him lick the site
to fight infection,
to avoid infection.
Yeah. So
but he hasn't been licking.
He hasn't had any interest in licking, so we've been lucky.
But I think that's it for 48 hours. So far, so good. The worst thing has been just getting that medication down his throat.
He was real pitiful yesterday. So it's good to see him
a little more normal today. Yeah. So we'll probably do another update maybe tomorrow, and then more like a little further out.
And he's forgiven me.
Can you see his site? I was trying to get the site. It's hard to see.
Well, it's on the inside.
It's there. Yeah. Not that anybody really wants to see that, but that's where they cut in.
Yeah.
And
interior.
You said that the vet said that bruising looks like blood.
Yes.
Which is what I think that is there. It's bruising on a dog.
So there's a lot of things, obviously, they've had people panic about.
Yeah.
That, you don't need to.
But he's doing pretty good so far. 48 hours out.
He's big.
He's big. Okay.
Okay, so we're going to show you the surgery site.
First of all, it's been 72 hours now.
Yeah, and see, looks very, very nice.
It looks pretty good, yeah.
Goes way up there too. There we go.
So that's the full thing. 72 hours later.
You can see how the bruising's a little different than humans. More of a, I don't know if that's more or different than a human, but you can tell.
It just looks like blood.
Yeah, it looks like blood.
His ankle is really swollen today, more so than yesterday. I don't think it's picking up as much, but it's pretty swollen.
He doesn't pee very much because I think all the fluid's going to his cankle.
Yeah, his bathroom habits are a whole lot different in general, I would say.
A lot of meds.
Yeah.
So found a diagram of the procedure. It's a TPLO. So tibial plateau leveling osteotomy. I believe I said that right.
I'll put a diagram up.
So the before diagram, basically the dog's natural structure of the knee, it's rounded, and so when there's movement, the knee wants to shift back. It wants to fall off it wants to go down the slope. and the cruciate ligament prevents that. So when they tear or injure the ligament, the leg moves back and causes discomfort. And so what they do is they change the structure of the knee, and they cut they cut off the rounded portion. They shift it down slightly and they level it, so it's no longer rounded, it's level. And then they put the plates in the screws to keep the bone in its new location, and when the bone heals and fuses, it's in its new location. And so now the knee wants to just go up and down, and it doesn't want to slide off. And that's why the operation is successful, is because it basically just changed the mechanics of the knee to where that ligament's no longer needed. That's how it was explained to me anyway, that the body doesn't need that anymore because the knee's not moving in its natural way. So.
And you did say this, whatever he had is specific to larger dogs.
Yes, this procedure is more common in the bigger dogs because they're putting the pressure on the knee that a little dog won't. I don't know what they do with a little one. They just may leave it to scar in. And I'm not saying they don't do this in little dogs, but it's more common in the big uns, like this guy.
And he's 130 pounds, just in case anybody's wondering what he is size-wise.
140 because of the cankle.
He didn't think that was funny, did you?
He doesn't like the cankle.
Real quick, because this is already getting really long, 72 hours. I would say this morning when you came down, because you got up earlier than me, he was excited to see you, right?
Yeah.
And
just like his old self.
Just like normal. And same with me. I came down about an hour and change later to take him out, and he was really excited. He was actually standing up in his crate and wagging his tail. Super excited to see me. So that was a big difference. Definitely more like his old self. So I would expect with each passing day for that to hopefully keep going that direction. Eating's a little bit better. Still, I mean, now even more so than yesterday, definitely more interested in food. Anything else?
Not so much interested in water, which is odd because he's very much a water drinker.
Yeah.
I think it's just the meds.
Yeah.
And I think at some point we'll kind of go over the physical therapy we have to do now.
Yeah, we have to do physical therapy now.
And really, it's just the manipulation of the joints of that leg. So you just run it through its full range of motion 15 times. Moving
that joint.
3 times a day.
And he looks pretty loopy right now, but again, this morning, he was almost like his old self.
It's like the pain and sedation meds took 3 hours to kick in, and they're a lot faster than that.
Because he was almost a little too
peppy.
Too peppy for his own good. But anyway, that's where he is, 72 hours. We'll probably do how he's doing in about a week, just to kind of update that. But that's going to be it for this video. Say bye-bye, Rocky.